Okay, right now we're going to demonstrate on how to rehabilitate the knee. Now remember, every time that knee swings in the air, it creates a negative and a positive pressure, negative and positive pressure. And that allows the superfiltrated blood to get in that knee and rehydrate the joint. So first off, you've already taken her to a corrective chiropractor where we've gotten a low back x-ray to make sure the nerve supply to the joint is appropriate. Now what we want to do, we want to regenerate the meniscus and regenerate the cartilage. Now she can just swing the legs back and forth very gently like this. Now you don't want to swing the leg up because that's going to spasm out this muscle and drive this little tiny bone here called the patella, it'll drive that back into the joint. So you want to just very, very gentle motion, and this is called a ligamentous exercise. Now let's kick it up a notch. What we're going to do is do ankle weights. Now the average person, as long as they don't have any ankle problems or knee problems that will be contraindicated, you want between 5 and 8 pounds of weights. Now these are about 7.5 pounds. So what this is doing, this is pulling and separating that joint out. Then she's going to rock them back and forth just like this. And she has to rock them back and forth where one goes up, one goes back. So they're not moving together. They have to move cross-crawl. That means one goes up and one goes down. Now what that's doing, that's pulling open the joint. It's straining the ligaments. By straining the ligaments, that's going to thicken them up. Also by this gentle movement, that's also going to start to reform the meniscus. Now the knee doesn't work like a hinge. It actually works like a screw. It moves twice as much on the inside as it does on the outside, so it has a pivot point. So even though it looks like it's moving like a hinge, it's actually moving slightly bit like a screw. So that's going to reform the meniscus. Now if you want to get it better even faster, you get moist heat on this. So you have the weights, you have the distraction, you have the movement, they're in a cross-crawl fashion. Then you take a damp cloth in the microwave, put moist heat right on it, and that moist heat, what that's going to do, that's going to rush blood to the area, increase the metabolism, and this is also going to help heal it. Now let's say you have some tissue damage in that knee joint. What that tissue damage is, it's abnormally placed proteins, like a bruise, torn tissue, torn meniscus. You've got cells in your body called macrophages. Now these macrophages, that means a big eater. So these big eater cells will get in there and start to chew up that abnormally placed tissue and absorb it, use those proteins back in the system so the body can reutilize it. That's the same way that bruises are healed. Here, watch this. I'm going to demonstrate a bruise. No, I won't do that. But that's what happens. When you have a bruise, that's abnormally placed blood proteins, and so those macrophages chew up that and put it back in the system so nothing's utilized. So you're going to do this exercise about 10 minutes, and what that's going to do, 10 minutes a day, and it may take, you'll notice a difference almost immediately in discomfort, but if you've had, say, 4 operations like I've had, it took me about 4 years to regenerate the meniscus. It may take longer, it may take less, but this is just one of the best workouts to regenerate the cartilage, regenerate the meniscus, and strengthen those ligaments on the inside. The only time that you don't want to do this is if you've torn the ligaments that connect the bones to bone, such as the medial collateral ligament or the lateral collateral ligament, or the cruciate ligaments. There's the anterior and posterior cruciate ligaments. I mean, so as long as the structures are intact, this is the best exercise on the planet to rehab the knee. Okay, ready? Now we're going to talk about rehabilitation of the calf. Once you correct the knee, you have to make sure that this calf is working correctly as well as the foot. Because if this foot can't dorsiflex or can't lift up, there's going to be a problem. Because if she can't lift this foot up at an extreme angle, the entire leg's going to have to move up and down, and that's going to start to cause hip problems. So if this isn't flexible, it's going to cause problems with the hip. Plus, inside of this muscle is a pump. Now, this is the furthest point away from the heart, so if this pump is working correctly, you're going to have oxygen or blood flow into the largest joint and the largest muscle group in the body. So this pump, which is called the soleus pump, is vital that that works. Also, if you have bunions or plantar fasciitis or any type of foot problems, if this pump isn't working right, this is never going to repair. So this is the single best exercise you're going to need. You're going to need a small block. It's about 3.5 inches by about 6-7 inches. And so here's the instructions. Please put your heel on the ground, the ball of your foot up like that. Now what she's going to do is she's going to leave the heel on the ground and bend her knee. Now she's going to hold this for about a minute twice a day. Eventually this knee is going to go away over the toe. So a normal knee, you're going to have the foot on the ground, heel on the ground, or the ball of the foot on there, and this is normal. This eventually will be normal. So you're going to see this normal in about a month to 2 months. That's going to restore normal mechanics. It's also going to allow her to wear high heels, which is going to be exceptional. Now, and that's how you restore the biomechanics of the foot, and this is absolutely essential to make sure that the hip and pelvis are working correctly too. We're going to talk about the biomechanics of the feet. Now feet, this also has to do with bunion formation. This has to do with virtually every foot ailment, plantar fasciitis, everything. First, you have to restore the nerve supply. You have to get the low back checked. Then you have to make sure that the knees are healthy. And this, again, this has to do with the feet. Then you have to make sure the calf or the pump on the back of the muscle, on the back of the leg, that soleus pump is working to make sure the nerve supply and blood supply goes down to the feet. Now you have to make sure you have a proper mechanics of the feet. So I would recommend these shoes are the absolute best because they provide full flexibility and movement. You want to have a shoe with virtually no arch support. Unless you have some type of operation that's destroyed the foot, the natural mechanics, you don't want an arch support. You want the foot to have full flexibility. Now, one of the best ways, and this is a way to eliminate even bunion formation, is to walk barefoot in the grass, dirt, or sand. Walking barefoot allows full flexibility and full range of motion. And the reason it has to be barefoot in the grass or hard sand is because this motion will actually strengthen the intrinsic muscles of the foot, allowing the foot to form normal muscle tone. Now, the reason you want to be barefoot is the earth actually has an electronegative charge. That means if you have skin on earth contact, it has an antioxidant effect. So you need to have full flexibility. What we recommend, and this is about 99% of the patients, is to make sure that the low back gets working correctly and then walk barefoot in the grass or hard sand at least 20 minutes a day. And if you are walking in the grass, watch out for squishy grass because that could be a doggy landmine. But after that, make sure that you're walking barefoot in the grass, dirt, or sand. Ready? Now we're going to talk about the shoulder rehabilitation. Now this is vital. When you look at the shoulder rehabilitation, remember, if that head is forward, that's going to cause the blood supply and nerve supply to the shoulder joint itself to be compromised. Now it's interesting. You've got this bone here that has 4 muscles that suck this bone into a small cup called the labrum. Now if any of those muscles get weak, and if that heads forward, that's going to weaken these muscles up here. So what do you have to do before you rehab the shoulder? You got to reposition that neck. You got to restore the neck curve. That's why we generally can't give shoulder exercises at least for the first couple of weeks in order to restore the nerve supply. Otherwise it'd just be cruel. You'd sit there, if you had a pinched nerve in the neck, it's like doing an exercise with a tourniquet on. So that's just crazy. So restore the nerve supply to the neck first, okay, to the shoulder cuff. Now, when you look at this, if her arms are turned inward, that means if she's relaxed and you're seeing the back of her hands, that means her head's forward and these muscles are chronically tight. Now, you don't want to loosen them up. You want to figure out why they're tight, so you want to reposition it. And this also has to do with guys that work out on the chest too much. They're going to have an internal rotation of that shoulder, which is also going to distort it. So you may want to give a very, very gentle exercise where they're just going to put their hand against a wall and just hold it here for about 1 to 2 minutes, 3 to 4 times a day. So first, look for internal or external rotation of this. Stretch that arm out just a little bit, not real far, and make sure that the neck is fixed. So now when she's standing at rest and you're seeing thumbs, then beautiful. Then the shoulder's in the right position. So now what we need to do is rehabilitate the shoulder joint. Now, you've got 4 muscles called the rotator cuff that are sucking that bone into that labrum. The problem is if any of those get weakened, and the most common one is the muscle on the top, this bone doesn't fall out, it falls up, because you've got this massive deltoid always pulling up. So if that shoulder's out, it's going to have a jamming appearance. So what we want to do, remember, this bone's stuck in the labrum, so we want to drop that bone down, the humerus down, and reform the labrum. And this is how it's done. You get, these are about 2.5 pounds each, or 5 pounds a pair. Very, very simple and easy. And then what you're going to do, you're going to turn the palms forward. And what that does, that rotates that humerus around inside of that joint. And then you're going to do a very, very gentle exercise where you're locking the elbow and the arm goes back just a little bit beyond the butt and forward just a little bit beyond the tummy. And it's going to be a very, very passive exercise, almost like a pendulum. And this, her head is positioned perfect up because that restores the blood supply and nerve supply. And you're going to go back just as far as you're going forward. So very, very gentle with the palms forward. What that's going to do, and that'll be about 10 minutes you're going to do this, and try and put moist heat afterwards. Why do we want heat on the joint? First off, she's dropping that joint down with the weights. She's rotating that arm out. She's rehabilitating or reforming that labrum. And then if you put heat on it, that's going to rush blood to the area and also increase the metabolism. I know. Brilliant. Now, we're going to cover carpal tunnel syndrome. Now remember, carpal tunnel syndrome comes from a muscle imbalance or a pinched nerve in the neck. It's a double crush injury. Now the forearm here, you've got muscles on one side, muscles on the other side. Normal strength ratio is 5-to-4, where these muscles are 5 times stronger than these. Well, what happens with this pinched nerve in the neck, it leads to a muscle imbalance. And that could lead to subluxations or bones slightly out of place in the elbow. So you have to get a qualified chiropractor to get your elbow checked to see if it's in place. If it is in place, then we need to restore the muscle balance. But now the worst part, remember, carpal tunnel syndrome, incredible intense pain of that area. It's actually, if you were to cut the skin off here and you could hold it back, it's about the size of a dime in there. So this tunnel itself is beautiful. But if it's crushed, if these muscles are too tight and the muscles in the back are too weak, that tunnel gets crushed and pinches the median nerve. It can be so bad it could wake her up at night. So what we want to do, if you're having trouble with carpal tunnel syndrome and you have the muscle imbalance, I'm sure you do if you have it, and it's waking you up at night, you know how you make a muscle imbalance worse? You brace it. Okay? That's the craziness. So what we have, and this is what I'd recommend if carpal tunnel syndrome is waking you up, here, put your finger and thumb together. What this is doing, she's forming the tunnel right now. So that takes pressure off. And then I'd recommend electric tape. The reason is, well, for 2 reasons. It doesn't stick to fur if you have hairy arms, okay? But also it's very flexible. Now you're going to put just 1 layer of tape around, not real tight, fairly loose. And you put it just right above or right on top of these bones here. They're called the metacarpals. And then relax your hands. And see how that forms the tunnel right there? No, say it with me. Wow, that's cool. It is cool. Because now she has full range of motion. She can type. She can do whatever she wants. And that will take all the pressure off the nerve. Now she's only going to need this tape on there to sleep just for about a week, maybe 2 weeks tops, because it takes us about that long to restore the normal muscle balance. But this is a heck of a lot better than any kind of a brace. So she'll leave the tape on, just a few hours at a time, maybe to sleep. And I've never seen anyone need that tape longer than a week. So now that we've got the nerve supply restored, or beginning to be restored in the neck, then we give her the extension exercises. Now these are wrist resistance extension devices. Yes, they look a lot like rubber bands, and they are. Okay, they're number 32 rubber bands. So what you want to do is you're going to put your hand like a flower bud, make it into a claw like you're going to scare someone. Flower bud to claw. Now she's doing it absolutely perfect. Here, let's try it on both hands. Because what you want the hand to come out where even the pinky comes out. And she's doing it absolutely excellent. Now what this is doing, this is working the muscles on just the back half. They're called extensors. And these muscles come down and they go right over the top of the tunnel. So if you increase the tone of these muscles, it takes pressure off of that tunnel. Now a lot of exercises for carpal tunnel, they're going to say stretch them or squeeze a ball. Totally wrong. That's completely the opposite of what's appropriate. What you want to do, remember, the muscle imbalance, usually the extensors or the muscles on the back of the hand are not developed. So you want to do this, and you want to do this to fatigue. Keep doing this, and when you're tired of doing it, do it some more. Okay, because what that's going to do, that's going to correct the muscle imbalance and stabilize the wrist. So if you're a secretary, if you work with your flexors, if you're a truck driver, if you do cashier, checker, whatever you're going to do, if you're squeezing your hand a lot, this is going to be the ideal exercise to rehabilitate, correct, and strengthen and prevent any carpal tunnel injury. Also, if you see anyone wearing a wrist brace, you absolutely have to tell them that wrist brace, if it's there to fix a wrist problem, they need to get their neck checked because it is a double crush injury. Carpal tunnel syndrome begins in the neck, leads to a muscle imbalance of the forearm, and leads to a problem of the wrist. This is vital that they do this. This is vital. And these I'm sorry, I almost said rubber band. These carpal tunnel exercisers, you can get them from any Staples, Office Max, anything. And I recommend number 32 rubber band. They're the best. Health Revolution.